the implementation here is very important. And I think one thing that's important to remember is that when the Pioneer HF study the whole program was put together, it was meant to be easily translated into clinical practice. And so to get into Pioneer HF, you had to have a low ejection fraction, you had to be in the hospital for heart failure, and then you had to have hemodynamic stability. And that definition is something that's fairly easy to remember and actionable, as a blood pressure of 100 or more, systolic blood pressure of 100 or more for 6 hours, not the whole hospitalization. And they couldn't have changes in their IV diuretics or their vasodilators for 6 hours. Again, something that's a very common scenario. And then no inotropes for 24 hours. So we think that that's a large cohort of patients, something that we all will encounter in clinical practice. And I do think that can be translated into practice. So, I think about a couple populations of heart failure patients, and I think for Sacubitril, Valsartan, there are now kind of 2 large published randomized clinical trials. So one was Paradigm HF. Those are outpatients, ambulatory heart failure patients, all low ejection fraction, large study, a lot of different types of comorbid conditions included there, and it seemed like a huge benefit in terms of clinical outcomes. For Pioneer HF, that's more of the acutely ill population of patients. It could be a new diagnosis, could be an old diagnosis, it doesn't matter, it's just that they're acutely decompensated. And again, whenever we looked across the subgroups there, age, race, differences in ejection fraction or renal function, we saw the same signals. So it seemed like it really helped a broad population of patients. So I think putting those together, we've learned a lot. There's an ongoing trial too that Duke is happy to be a part of, that's called the LIFE trial. And that's more of the kind of chronically advanced heart failure population. And so we're going to learn a lot as that trial completes too.